All right, so good afternoon, everybody. Thank you for joining us today. Hopefully you are here for the right presentation. This is the Pikes Peak Library District and the Area Agency on Aging's collaboration for our Lunch and Learn. Today we're going to be talking about Medicare open enrollment and doing a Medicare Plan Finder demonstration. So a couple of quick notes. I will try and get through this presentation as quickly as possible because I know we're short on time. We are going to be doing a live demonstration with the Medicare Plan Finder. If you have any questions, I will pause a couple of times to see if there are any questions. To ask questions, you can simply unmute yourself and ask the question live, or you're welcome to type it into the chat box. And I will address those questions when we take a pause. Hopefully you also received the email that I sent out just recently. It was probably within the last 20 minutes that included the handouts for today's presentation. For your convenience, I will be referencing some of these handouts, but most of them are just for your convenience. And I think that's it. So let's get started. So we're going to start with who we are. I am with the Pikes Peak Area Agency on Aging, and the mission of the Area Agency on Aging is to remove barriers to independent living in the community. And we do that by developing and coordinating systems and programs for our region, which is El Paso, Park, and Teller counties, that help people accomplish that goal to stay in the community for as long as possible. This is, of course, in partnership with the Pikes Peak Library District. Pikes Peak Library District has been around for over 50 years and has tons of wonderful programs. And I'm feeling that that's probably where you heard about this presentation. And within the Area Agency on Aging, I am with the SHIP program, the State Health Insurance Assistance Program. The SHIP program is a federally funded program that is available to anybody. There's a program in every county of every state in the country. And what we do is we provide unbiased and free information, education, and assistance in all things Medicare. We are true consumer advocates, and we are here to educate. We don't sell or endorse any specific insurance products or companies. The SHIP program through this Area Agency on Aging actually serves 9 counties of Colorado. And we are available either by our local Colorado Springs number or by our toll-free statewide number. If you call the toll-free statewide number listed at the bottom of your screen, it will route you to the SHIP office closest to the county or in the county that you're calling from. So today we're talking about open enrollment and why it's important. Open enrollment for Medicare is coming up fairly quickly. Mid-October is when it starts. There are a couple of enrollment periods that people need to be aware of when they have Medicare. During these enrollment periods is when you have the ability to either get into, get out of, or switch from one Medicare Part D plan or Medicare Advantage plan. The first enrollment period is obviously when you first become eligible for Medicare. Eligibility for Medicare is either based on turning 65 or it may be based on having been determined to be disabled by Social Security, but it's a 7-month period surrounding that initial eligibility into Medicare. And for those turning 65, that includes the 3 months prior to the 65th month of the 65th birthday, the month of your 65th birthday, and up to 3 months past the month of your 65th birthday. The same 7-month applies to people who are on Medicare under age 65, but it surrounds the month that you're told by Social Security that you're eligible for Medicare. And then what we're talking about today is the annual enrollment periods. So what we tend to call just open enrollment for Medicare is actually the annual election period, open enrollment period. And this is an annual, every year enrollment period that allows people to review their coverage, whether it's a Part D plan or an Advantage plan, and decide if they want to make any changes to go into effect for the next year. And then a couple of years ago, Medicare created the Medicare Advantage Plan open enrollment period, which is an extended amount of time for people specifically in Advantage plans to be able to make changes to that coverage. And then there are always special enrollment periods depending on your situation. So again, the annual election period, which we tend to refer to as simply open enrollment, October 15th through December 7th every year. Again, this is the opportunity people have every year to make a plan change, whether you're in a standalone Part D plan or if you're in an Advantage plan. During this time frame, you can either get into a plan, you can get out of a plan, or you can choose to switch from one plan to a different plan. Any changes you make during this enrollment period don't start until January 1st of the following year. And then if you have an Advantage plan, or if you are enrolled in an Advantage plan as of January 1st in any given year, you would actually get an extended enrollment period. So the Medicare Advantage open enrollment period started a couple of years ago. If you're in an Advantage plan as of January 1st of the year, you get a 3-month window, January 1st through March 31st, to decide if you want to make an additional change. This enrollment period is only for people who are enrolled in an Advantage plan as of January 1st of any given year. During this time frame, you can choose to either get out of Advantage plans altogether, or you can switch to a different Advantage plan. And any change you make during those 3 months goes into effect the first day of the next month. And once you've used one change, then your enrollment period is over. If you're not enrolled in an Advantage plan as of January 1st of the year, this enrollment period does not affect you at all. This is not an enrollment period you can take advantage of. So we are going to do a Plan Finder demonstration. The Plan Finder through Medicare.gov's website is honestly the most effective way to review your options, whether you're in a Part D plan or an Advantage plan, from year to year. The reason you'd want to do this is honestly to make sure that you are in a plan that's most cost effective for you. And this is especially important if you're in a standalone Part D plan. So we're going to do a Plan Finder demonstration. A couple of tips, and the slide you see here is the home screen or the home page of the Medicare.gov website. From this homepage, if you are interested in either using the Plan Finder yourself or just for informational purposes, from the homepage of the Medicare.gov website, we are going to look at Find Plans. So we're going to click on the button that says Find Plans, Find Health and Drug Plans. Once you click on that button, you'll be given a couple of options. You can either log in or you can create your own Medicare account. If you log in, that means you've already created an account. To create a Medicare account is actually quite simple. It takes just literally like 5 minutes to do. Or if you click that button, it'll allow you to create your own account. There are advantages to creating a Medicare account. One of the advantages would be that it saves your list of medications when you're using the Plan Finder from year to year, so that you don't have to re-enter all of that information during the next open enrollment. That information will already be there, and you simply have to update it if there have been any changes. The other advantages is that it would also allow you to print a replacement Medicare card. It allows you to look at any claims that have been submitted by your providers to Medicare in real time. So there's a lot of features that a My Medicare account can provide to you. Creating a My Medicare account or creating a Medicare account is not required, but it is strongly encouraged because of those advantages. Once you click on the login or create an account button, again, it'll take you to a login page where you can either log in using your username and password that you've already created, or if you haven't already created an account, you'd want to click on this little sentence up here, just under the login, where it says create an account now. Once you click on that button, it will take you to the step-by-step of creating an account. I've also included in an email that I sent you earlier this morning, a handout that kind of walks you through that process as well. Again, it takes literally just a few minutes to create a Medicare account, and there are some good advantages to doing that. But again, it is not required that you have an account. If you don't want to create a Medicare account, you don't have to. And when you get to this page that says log in or create an account, instead of clicking on the login or create an account button, you would click on the little underlined sentence under that where it says continue without logging in, meaning you can use this plan finder and all of its features without having an account. So what we are going to do is we are going to do, again, a live demo of this plan finder. So, oops. So we are going to go to the home page. Oops, let me share my screen. So here's the home page of the plan finder. Again, we are going to click on Find Plans. But we are not going to log in or create an account. We are going to continue without logging in. Whether you have an account or not, once you've logged in, or if you go in without logging in, the next page you're going to get is going to look like this. And because we have not created an account, it's going to ask us some questions. If you create an account, there should be some information already populated. So if you are able to create an account for the Medicare website, it will tell you what plan you're currently in if you're already enrolled in a plan. And it will also tell you whether or not you are eligible for extra help. It can tell you what plans you've had in the past. But again, because we haven't created an account, we're not going to create an account. We're going to have a couple of questions to ask or to answer. So the first question it wants to know is, what kind of plans do we want to look at? For today's presentation, we're going to look at drug plans only, or standalone drug plans. And then it's going to ask us for a zip code. And I'm going to use the zip code of our office, which is 80905. It's going to confirm that that's El Paso County. And then it's going to ask us if we qualify for any financial assistance, because we have Medicaid, SSI, have applied for Medicare savings programs. For today's purposes, I'm going to say I don't get any help from any of these programs. However, again, if you create an account, it should acknowledge or show you whether or not you have extra help or not. So if you are eligible for any financial assistance programs that would help save on the drug plan costs, it will tell you that. If you do not qualify or have not applied, it will say no assistance listed. So once you've answered those questions, it's going to ask you to start entering drugs. This feature is very, very important because this is going to determine the accuracy of any search that you do. So anytime you're looking to compare your options from year to year during open enrollment by using this plan finder, the accuracy of the information you put in as far as the drugs that you take is the most important thing about this whole system, because it's the accuracy of the medications that you take that will determine what your actual cost estimates might look like. For today's demonstration, I am going to put in 3 drugs just to show you how accurate you can be when listing your medications in the system. So we are going to start with some pretty common medications. I'm going to start with Lipitor as the first one. So you simply type in your medication. You'll notice that as I started typing, it started already populating a list down below. So it's already showing me drugs that start with LIP. You can either pick one of those drugs that are auto-populated in the drop-down, or you just can continue typing. You can spell, and it will give you a list, a final list of all the drugs that might fall under that spelling. So we are going to pick Lipitor, click on that, and then you have to click on Add Drug. When I click on Add Drug, a pop-up comes on the screen that tells me that Lipitor is available as a generic drug. Anytime you are taking a medication and you type in the brand name of that medication, if a generic is available, it will tell you that a generic drug is available for that medication. And it will ask you if you would like to use the generic drug. Obviously, generic drugs are probably going to be more cost effective, but I know some people also need to use brand name drugs for various reasons. So it's going to give you the option of either adding the generic drug instead of the brand name or insisting on using the brand name. For Lipitor's purposes, we're going to add the generic. So instead of Lipitor, it's now showing us atorvastatin, which is the generic name for Lipitor. Then we get to pick the dosage. Again, this is a drop-down box, and it's going to list all of the doses or dosages that Lipitor comes in, from 10 milligrams to 80 milligrams. It's also going to say that it comes in only tablets versus, say, capsules. It will automatically populate with the most commonly prescribed dosage, usually. So 40 milligram tab is what was auto-populated before we hit the drop-down box. That means that's the most commonly prescribed dose. And you can either leave it at that, or you can switch it to a different dose. Then it's going to ask how many pills you take per month. But you can change that frequency by how often you refill that medication. So you can either do it monthly, 2 months, 3 months, 6 months, or yearly. Most of us will probably do monthly. Even if you take or you get your medications by mail order every 3 months, I would still encourage you to just show as monthly here, because you will be able to pick a mail order 3 month supply further in this presentation. So I encourage people to stay at the every month frequency or every 2 month frequency, unless you only pick something up, you know, like you get a tube of cream or something and you really only need to pick it up once every 3 months. That's when I would choose the every 3 months frequency. But we're going to leave this at 1 tab a day, 30 tabs per month, and we're going to add it to the list. And because I was playing around in this system earlier today, it already shows that I had put in levothyroxine, but I'm going to remove that drug. We're going to add a total of 3 drugs for today's purposes. So it's confirmed that this drug has been added to my list. So I'm going to add another drug. The next one I'm going to add is, let's go with potassium or Chlorcon, which is a pretty common medication. So again, I start typing and it starts to auto-populate with possibilities. So I'm going to pick Chlorcon as the medication and add drug. Obviously, Chlorcon has been around for a while. It's a pretty common medication, pretty commonly prescribed as a generic. We are going to use the generic for this medication, which is potassium chloride. The reason I picked this medication is because it comes in an extensive list of options as far as the dosage, and it's going to highlight the importance of making sure that you are putting in your medications accurately. So potassium chloride comes in many different forms. It comes in capsules, extended release. It comes in solution. It comes in a different percentage of solution. It comes in extended release capsules, crystal ER or extended release. It comes in tablets, extended release. So lots and lots of different options. And it's very, very important that you pick the most accurate option. Typically, you can look at your pill bottles directly and match what it says on your pill bottle with one of the options listed. But when it comes to a medication that you entered and you hit that pop-up or you hit that menu and it has this many options, I just wanted to highlight that it's very, very important you pick the accurate option, because the difference between picking one of these options versus the other options can be a huge difference in price when it comes to what you have to pay at the pharmacy. For today's purposes, we are going to pick probably the most commonly prescribed option, which is potassium crystal ER. Comes in 10 MEQ tablets, extended release. How do I know that's the accurate one? Well, for today's purposes, I don't know, but it should say that on your medicine bottle, and it usually does. Again, we're going to leave it at 1 tab a day every month, 30 days, and we're going to add that to the list. The third medication we're going to do today is, let's go with metoprolol. So it's got our 2 drugs listed and saved. We're going to add 1 more drug. We're going to add metoprolol. The reason I picked this medication is because it comes in 2 forms. It comes in metoprolol tartrate and metoprolol succinate. There's a huge difference between the 2. So you have to be very, very careful about which one you pick, because there's also a huge cost difference between the 2. Most common, from my experience, is going to be the metoprolol tartrate. So we are going to pick that. Comes in pretty common dosages, comes in tablets only. It defaulted to 25 milligrams. We're going to leave it at that. It defaulted to 2 tabs a day. We're going to leave it at that. We're going to add it to the drug list. Now, I think for today's purposes, let's add 1 more medication. Let's add an insulin, just for the heck of it. We're going to add Novalog. So again, I start typing, it starts to auto-populate with everything that starts with those letters. So we've got Novalog, Novalin, Novalin N, Novalin R, Novalog mix. Then it starts going into further outside that spelling, but we're going to pick Novalog. I know Novalog comes in a couple of forms. You can either get it as insulin in a vial, or you can get it in a pre-filled pen. So we click on add, and it's going to tell us that Novalog is now available as a generic, and that generic is called insulin aspart human. This is actually new information. In the past, when you were adding insulins, it did not give us this information. So this is a new feature that was added for 2021's open enrollment, which is a good thing, a very good thing. We're going to leave this as brand name though, for today's purposes. So Novalog as a brand name is auto-populating at 100 units millimeter solution pen injector. If I hit the drop-down box, it comes in just the solution or vial, it comes in a cartridge, or it comes in a pen injector. Most people are going to pick the pen injector, the pre-filled pen. It's going to look at quantity. So it's telling us that those pre-filled pens come in 3 milliliter pens. So they have 3 milliliters of solution in each pen, and the pens are sold in packs of 5. For the quantity for this purpose, you want to tell them how many packs of 5 you would use per month. So if you only use 1 pack of 5 pens per month, you want to leave the quantity at 1. You're not telling them you use 5 pens, you're telling them you use 1 pack of 5 pens per month. And we're going to add that to the list. So now the system has saved these 4 medications to the system. What this is going to do is it's going to, the system, this plan finder is going to take this list of medications And it's already starting to compare this list to the plans available. And it's already taking the plans available and starting to put together a list of all the plans that cover these 4 medications. And it's going to start listing those plans in order of the plans that save the most money on these medications. But we've got one more step before we get there. So we're going to tell it that we're done adding drugs. And then it's going to let us pick pharmacies. When it comes to the pharmacy options, keep in mind that the options are going to be listed based on the zip code that you live in or the zip code that you may have entered. Because I entered 80905 as the zip code, it's going to give me all the pharmacies in a radius of that zip code. So it's like a 5 or 10 mile radius from the center of that zip code. It's going to list all the pharmacies available. Or if you have a specific pharmacy that you want to use, you can type the name of that pharmacy in the box and it will list that pharmacy as well. But I tend to just like to see what pharmacies are available in that radius. Here is where you might choose if you prefer to do mail order for your medications. Here's where you would choose mail order as an option. So it will compare and show you what these drugs would cost if you went through the mail with any of the plans. But it's also going to list all the pharmacies within that radius of the zip code. I haven't even heard of some of these pharmacies, but there are a total of 6 pages. And these pharmacies are going to be listed again within that radius. It also has the map that shows you that radius. You can zoom in, you can zoom out. You can go very, very specific. The pharmacies have numbers listed next to them. So you can click on a number and it will tell you what pharmacy that is. I encourage you, if you're going through this process, to pick multiple pharmacies. Even though you may have a pharmacy preference or there's only one pharmacy you ever use, I encourage you to look at multiple pharmacies or at least compare multiple pharmacies just so that you can see whether or not there are more savings or a better deal at a different pharmacy. Unfortunately, the pharmacy that you use with Medicare drug plans can make a difference in how much you pay. Some pharmacies have made specific price negotiating deals with some plans. So if you enroll in a specific plan and that plan has negotiated with a specific pharmacy to provide even more savings if you use that pharmacy, it's good for you to know that, I believe. It never hurts to know that. Even if you choose to use only your pharmacy of preference, that's fine. But it's always good to know if you could save more money by using another pharmacy. So we're going to pick a total of 4 pharmacies. They've listed those pharmacies at the bottom of the screen. You can choose up to 5 options, but we're going to stick with 4. So 3 local pharmacies in mail order. And we're going to click done. Once we click done, this is the end result of this search. This is going to give us a list of all the Part D drug plans, standalone drug plans available in Colorado for this year. And these plans are listed. And you can see here on the screen, it says plans are sorted by the lowest drug costs plus the premium added together. So the total of the copays at the pharmacy and the premium added together for the rest of this year. So it's going to list these plans in order of the lowest out-of-pocket cost to you in premiums and copays at the top of this list. So the plan that's coming up at the top of this list, which would be the most cost-effective plan for you to enroll in for the rest of this year, SilverScript Choice. It's going to show us the premium for this plan. It's going to show us the estimated total drug costs plus premium for the rest of this year. So if you were to enroll in this plan with that list of drugs, you'd be looking at about $120 in total out-of-pocket cost for the rest of this year. So that would be October, November, December. It's also going to tell us if this plan has a deductible at the pharmacy. This plan does. It's a slightly reduced deductible because the max deductible for 2021 is $445. This plan only has a deductible of $370. So this is the most cost-effective option at the top of the list. If we continue to scroll down, it's going to tell us the second most cost-effective option, WellCare Value Script. This plan has a slightly lower premium, actually a significantly lower premium, $14.50 a month, but the total cost for the year is higher, $163 versus $119. So even though the first plan that comes up has a higher monthly premium, overall, it would cost you less money for the rest of the year. So obviously this plan would have lower copays at the pharmacy. This plan has much lower premium, but it would obviously have higher copays at the pharmacy for the medications that we listed. This plan also has a deductible, $445, may or may not be applied to the medications that we listed. Third plan, again, these plans are listed in order from lowest out of pocket to highest. So as we go down this list, this yearly drug and premium cost is going to continue to increase. So now we're looking at $167.97, even though this plan only has a $16.40 premium. Again, we go down to the next one. This plan has a huge premium, $67.60. Total out-of-pocket cost is over double of what the previous plan was, 167 versus 124. The whole point of this system, this plan finder, is so that it does all the work for you. So what I want you to keep in mind is that even if a plan has a really low premium, it doesn't mean it's going to be your best option. Even if a plan has a really high premium, it doesn't mean it's going to be your best option or give you the best savings at the pharmacy. The plan finder does all of the math for you and does all of that calculation for you so that you can relax and just let it do that work. And it's going to tell you what plans will save you the most money on the drugs that you take. So we're going to scroll back up to the top of the list. There are some additional filters that you can change this search results by. You can go by plan type. So it also gives you the option of not looking at just drug plans, which is what we're looking at now, but you can also, if you click the Medicare Advantage plan, it will give you the same information, but only for the Medicare Advantage plans. We're going to skip that. You can go and look just by the insurance carriers, by the companies. You can look by star ratings. Honestly, I've always felt that your best bet is to go by price, because ultimately that is going to be the most important factor for most people. So now we're at the list. We're going to pick the top 3 plans and look at these plans side by side. So we're going to click on this little button here that says add to compare. You can compare up to 3 plans at a time. So we're going to just take these first 3 plans on the list and add to compare. And then down here, we're going to hit compare. Again, this website has been updated in the last month to make it easier to look at and to understand. So now we have 3 plans side by side with a comparison. Again, SilverScript Choice came up as the most cost effective, and then 2 WellCare plans came up as the next 2 best choices. We got WellCare Value Script and WellCare Wellness. Premiums for the Value Script, $14.50. Premium for WellCare Wellness, $16.40. It shows you their star ratings. 5 stars is the best. Very few companies ever hit 5 stars, to be perfectly honest with you. And currently there are no 5-star companies in Colorado. Again, it's going to show you the total premium for each plan. It's going to show you the yearly deductible for each plan side by side. It's going to tell us that 4 out of 4 drugs that we listed are covered by these plans. So every one of these plans covers all the drugs that we listed. And then it's going to show us the pharmacies that we chose. And it's going to show us what the total cost, that drug cost plus the premium for the rest of the year, is at each pharmacy. And this is where you're going to see the difference between what pharmacies you choose to use. So for the Silver Script plan, we picked 4 pharmacies, well, 3 pharmacies in mail order. It's going to show us those costs at those pharmacies. If you'll notice, the 119, which was the overall most cost-effective pricing, was at Safeway and at Walmart. And you'd even save a few cents by mail order with this plan. If you go to Walgreens, not so much. Co-pays at the pharmacy at Walgreens would be much higher. It also tells us that Safeway and Walmart are preferred in network pharmacies, where Walgreens is just a standard pharmacy, which is one of the reasons the total cost for co-pays is higher. If we go to the WellCare Value Script plan, again, these plans had a little bit more in copay costs at overall. So again, it's going to show us Safeway or preferred pharmacies. Walgreens is a preferred pharmacy for the value script. For the wellness plan, Walgreens is a standard pharmacy. And you'll notice, even though these are the same company, they're 2 separate plans with 2 separate pharmacy networks. And the cost difference between one plan or the other and the pharmacy network is pretty big. So in the value script plan, where Walgreens is preferred, you're looking at 163 overall for the year. But if you go to the wellness plan, the pharmacy is a standard pharmacy at Walgreens. Your costs go up significantly at the pharmacy. Walmart for wellness value, or for the value script, is standard, costs go up. For the wellness plan, Walmart is preferred, costs go back down. This is how important the pharmacies can be. And this is why I encourage you to look at multiple pharmacies so that you can see these differences. If you had put in Walgreens only as the only pharmacy option to look at, you would not be able to see this information. It would give you the plans that would save you the most money at Walgreens, period. Whether or not that would be the most cost-effective way to go may or may not be. So if you'd put in only Walgreens, these plans may or may not have shown up, but it certainly may not have told you the most cost-effective options you had for next year or to enroll in for drug coverage. So this is really the side-by-side comparison is going to give you the basics, going to give you the total costs. If you wanted more information, such as what would the copays be with any particular plan, scroll back up and hit under each plan, there's a plan details. This is going to go into the specific plan that we picked. Again, we're looking at Silver Script Choice with a total premium of $29.70 a month. Gives us the estimated total drug cost for 4 drugs. Reviews that information again, shows us the deductible with this plan. Again, goes over the preferred or standard status of the pharmacies that we picked. Then it's going to give us the good information. This is what the copays would be for these medications if you went to any of these pharmacies. And this is where we can see why there was a difference in the total cost between the different pharmacies. So with this plan, this Silver Script plan, if you went to Safeway, which is preferred pharmacy, you're looking at the generic Lipitor, the Metoprolol would be 0 copay. The Novalog insulin pens would be a $15 copay. Potassium would be a $15 copay. At Walgreens, you're looking at higher copays. The 2 generics at the top would be $15 instead of 0. The Novalin or the Novalog would be twice as much, a $30 copay. Potassium would again be $15. So your cost per month would be much, much higher if you went to Walgreens than if you went to Safeway. Again, Walmart is preferred, so your costs are going to be the same as if you went to Safeway. And the costs are basically the same if you did mail order 90-day supply. 0 copay for the generics, $15 copay for the mail order, and just under $15 for the potassium. And these are the costs for the rest of the year. So total costs, again, are going to be summarized based on the pharmacy choice. And then it's going to break it down by month. So total cost per month. So what you're looking at here, oh, wow, my apologies. So what you're looking at here is your total cost for the rest of the year on your medications. So you're looking at $15 for the rest of the year. When it breaks it down here, you're looking at total copays per month for all 4 drugs. So this is slightly different than it was last week. So my apologies. So this is breaking it down month by month. And if you're doing a search during open enrollment, this is actually going to break it down into 12 months because they're going to be looking at the 2022 plan choices and costs. Because it's not open enrollment yet, we only have the last 3 months of this year to look at for comparison purposes. But it during open enrollment, it will break it down to the 12 months of 2022. So you can see very specifically what your cost would be. So it's breaking it down what these 4 drugs would cost you at the pharmacy, all 4 of them added together month by month. Again, if you did mail order, you'd only have to pay that copays one time because it'd be a 90-day supply. And then you can look at the different costs during the coverage phases. This is not auto-populated, but it gives you the option of looking at that based on pharmacy. When you go into this bit of information, it gives you much, much, much more specific information. So when we look at these drugs in the coverage options or the coverage phases, this is going to tell us that Safeway, the generic Lipitor, retails for 66 cents a month. Your copay would be $0. Does not apply deductible to that. The Metoprolol retails for 54 cents a month. Your copay would be $0. This is a biggie. Novalog injector pens, pack of 5, retails for $590 a month. Your copay would be $5 a month. Potassium chloride retails for $5.25 a month. Your copay would be $5 a month. None of these are applied to deductible. So you're not paying full retail price to try and meet a deductible with this plan. If you had to meet the deductible with this plan, you would have to spend $370 before you met the deductible out of pocket. And then you would go into these $0 and $5 copays. But this plan is not doing that to you. It's not applying any of these drugs to deductible. So you're going straight into copays, very, very low copays. If somehow your list of drugs was larger or different and you were to hit the coverage gap or the donut hole, your cost would go up with these drugs in this plan. And it shows you what that cost would be at the pharmacy if you hit the coverage gap or donut hole. And if your drug costs were even higher, that you hit not only the coverage gap, but you exceeded it and hit catastrophic coverage, which is the last phase for drug coverage, your cost would go back down to 5% or less. And then it totals it up monthly. And it's going to do that for every pharmacy so that you can see what each pharmacy retails those drugs at, what your copays would be month by month. And again, Walgreens is not a preferred pharmacy with this particular plan. So the retail cost, instead of less than $1 for the 2 generics, is $5 and change. And that's where some of that extra cost is coming from. But it's going to give you the specific information for each and every plan if you want it. And for mail order, the mail order option, it's giving you the cost for a 3-month supply or 90-day supply. And the last thing it's going to tell us is the overall star ratings. And if you click on the plus sign, it's going to give you the details of how they came up with these star ratings, the specifics. So even though this plan only gets 3.5 stars, If we click on the plus sign, it's going to show us that the drug plan customer service rating was actually 5 stars. It was the other factors that may have lowered that to 3.5 stars overall. It will give you more detail about that. So if that's something that's important to you, you have access to that information. Scroll back up to the top. We want to go back to the plan comparison, where it shows the 3 plans side by side, and you can look at the plan details for each and every plan. If you decide to enroll in a plan and you're able to enroll in a plan because it's either open enrollment or you have another opportunity for a special enrollment period, you would simply click the enroll button. It will ask you a couple of questions. You click join plan, and it will walk you through the enrollment application process. Very, very simple, very easy to use, very easy to understand. So this is the gist of the plan finder. Again, this is going to be your most effective tool when trying to compare plans or looking at other options from year to year. Again, if you're in a standalone Part D plan, I strongly encourage you to take advantage of open enrollment. When you're in a standalone drug plan, that plan can change a little more significantly from year to year than, say, drug coverage through an Advantage plan. And those changes could be in the form of a change in premiums from year to year. It could be a change of copays. It could be change of medications that they will cover. It could be change in deductibles. It could be change in network pharmacy preferences. Plans can change quite significantly from year to year. And yes, if you're already in a plan, you should have received, or you should receive every year from that plan, your annual notice of change, usually sometime in September. So those should be coming any day now. That tells you what changes that plan is going to make for the next year. But to be able to compare that to other plans available for the next year can be significant. So I do see I have a question in the chat. Question is, why do some companies not apply some prescriptions to the deductible and some companies don't? So for generics only. So again, we looked at the Silver Script plan. We'll go back into the plan details. And it showed us that this plan did not apply these medications, this particular list of medications, to the deductible. Typically, what that means is that those medications are considered preferred. Unfortunately, that is information that is no longer available as far as what drugs are considered preferred or not preferred. There used to be tier levels that you could see. You used to be able to see if it was preferred or not preferred, generic, preferred or not preferred, brand name, that kind of stuff. Typically, when a plan is not applying a medication to the deductible when it has one, it's because it's considered preferred. That can include both generic and brand name drugs in that preferred category. Non-preferred drugs are usually always going to be applied to deductible, unless, of course, that plan does not have a deductible, but there are very, very few plans that do not have a deductible anymore. So yes, typically it's going to be more likely to be generics that would not be applied to deductible, but there are some situations where brand names, as long as they're considered preferred, would not also be applied to deductible. And it's totally up to the company that you enroll in and the plans that they are offering as to whether or not they want to do that. So it's not anything Medicare mandates. It's totally the plan's choice as to whether or not they will consider drug preferred and not applied to deductible. But again, that can make a huge difference in what you spend in the year and at the pharmacy. And so it's certainly something to be aware of. Again, the best way you're going to realize that is by going into the the coverage phases, which is going to be this little link that you can click on. So when it says estimated drug costs during coverage phases, which is about 3/4 down the page, if you click on that, it's going to give you some explanation of the different coverage phases. But you can click on the pharmacy specifically that you picked, and it will show you the coverage phases. And if it says cost before deductible and it doesn't show full retail price, that typically means that those drugs are not applied to deductible. And that's going to be the best way to be able to tell that in the plan finder right now. So hopefully that answers your question. Are there any other questions about this plan finder or anything you wanted to see in the plan finder that I wasn't able to show you already? Again, if you have a question, you can simply unmute and ask your question, or you're always welcome to type it into the chat box.
So Roma, I understand that if someone goes in generically like this and they do not set up a username and password, all this information will be lost when they leave the site. Is that correct?
Correct. So by not creating an account, I entered these medications and pharmacy preferences. As soon as I close this web page, all that information is gone. And if I want to go back and look at it again, I'm going to have to re-enter the medications and the pharmacy preferences again. That is one of the benefits of having a Medicare account, is that it saves that information so I don't have to re-enter it when I go back in. I can edit it as needed. So it will take me to that point where it'll show me my list of drugs and give me the option to make any changes or additions, but that list will already be there. I won't have to completely recreate it.
What is the difference between putting in you had suggested putting in monthly dosages and then waiting until the end there to add mail order, which would show you 3 months? What's the difference in putting in the beginning the dosage as 3 months versus the mail order? Is that going to be the same as if it were mail order price?
So the whole point of putting in the dosages per month. So if we go back here and we are looking at quantities and dosages, the point of putting in the quantity you take per month and the frequency is for those situations where you may only pick up a refill, or you only need to refill something every 2 or 3 or 6 months. So again, if you have a cream that lasts you 6 months, you only need to pick up a refill once every 6 months. You can pick that option here. When you are looking at mail order versus putting in a 3-month quantity here, if you put in a 3-month quantity here and then choose mail order on the next page, it's going to look at giving you a 3-month supply every 3 months instead of a 3 months. Well, it's hard to explain. It can make a difference depending on what medication you're putting in. So if we do a 3 months, you get a 30 pills every 3 months. It's only going to add 30 pills for a mail order 3-month supply instead of 90 pills for a 3-month supply. Does that make sense?
So you'd have to put in 90 then. If you were looking at a 3-month supply and they're used to getting a 3-month supply, you'd put in 90 every 3 months. And that would be comparable then to the price that mail order would show when you look at mail order.
So let's update that, say 90 tabs every 3 months. We're done adding drugs. We're going to stay with the same pharmacies, including mail order. Plan results come out the same. Well, a little bit different in pricing, not by much. So let's look at the plan details and see what happened. So we're going to scroll down to the pharmacies and look at mail order. So again, it did calculate 90 tabs every 3 months as a 3-month supply. So the cost would be the same in that situation. You'd only pay the one copay for 90-day supply through mail order 90-day supply. But again, the general purpose of that previous screen is for those medications you don't take every day necessarily, or you don't need to refill every month. But as long as you put in a 3-month quantity on that screen where it says dosage and frequency, it should come out accurately if you use mail order.
They should be relatively the same then. The cost should be relatively the same.
Correct. But if we had left it at 30 quantity every 3 months, it would have been a price difference because it would only calculate 30 pills for a 3-month supply.
Okay.
But again, this is more likely to be used for those medications you don't need to pick up every month, or you don't refill every month, or you don't use every day.
This right here that you're showing on the screen, that's the ones that you're saying. Okay.
Correct.
But you can combine, can you not? Say if you have 10 medications and then you have some that would be infrequently, but then you would have some that you get every 3 months, you could combine the two and put 5 for 3 months and the rest for monthly, right? And the plan finder will make it okay.
Correct. Yep. Yep. So, and keep in mind that this plan finder is a search engine, and it's designed to provide you with the most accurate estimate cost. So when I say accurate estimate, remember the word estimate, because as accurate as Medicare tries to make the information that populates this search engine with, it's only as accurate as the information that the plans give Medicare. And sometimes that information can change at the last minute. Medicare discourages that from happening, but it can happen. So it's always best to, if you are not sure or have questions or really, really, really want to be as accurate as possible, when you use this plan finder, you get to the final results, you want to make sure that $5 copay for levothyroxine or for the Novalog pens, that $5 copay is going to be accurate. Call the plan directly or go to the plan's website directly and verify that. Again, Medicare tries to make this as accurate as possible, but you can't rely on it 100%. If you have any questions or if you absolutely need to know the specific pricing of a drug. For the most part, this plan finder has always been accurate for as long as it's been around, which has been quite a while now. Occasionally there might be a few cents or a few dollars difference in what you pay at the pharmacy versus what the plan finder may have quoted you on a copay. But any significant difference in what you're quoted in a copay on the plan finder versus what you end up having to be paying at the pharmacy, if you ever come across that scenario where the plan finder said no deductible $5 copay, but you go to the preferred pharmacy and they're charging you $150 copay, that's a problem. And that's a problem you should probably call 1-800-Medicare about, or you can always call your local SHIP office and we can help walk you through that process. There shouldn't be that kind of inaccuracy. So don't let that be an assumption that that's okay. If that situation arises, tell somebody, tell us, tell Medicare, tell the plan that something's not right.
What if I have a good plan this year? We're looking at like next year, and I have a good plan and it looks good for the next year, but it's not carrying one of my prescriptions that I had this year. Do I have any recourse to talk to that plan to see if they can carry my drug?
So again, that's the whole reason open enrollment exists, is for those kinds of changes. Of your plan that you have this year suddenly is not going to cover something you take and you need them to cover it. Open enrollment is designed to allow you to either find a plan that does cover that medication as well as all of the others for the best price. But if you're really, really insistent on keeping the plan that you have for whatever reason, Medicare does have processes that allow you to request that they keep that medication for you. There are formulary exception requests that you can make to the plan that would ask them to continue to cover that medication for you specifically, even though they've chosen not to put it on their formulary or list of covered drugs for that year. In order to get an exception, a formulary exception request approved, you know, that's really going to be up to the plan. There's no guarantee that it would be approved, especially if there are other plans that might cover that medication for you as well. But there are those processes, and it never hurts to involve the doctors in those processes. So you can either ask for a formulary exception if the plan stops covering a medication. If the plan changes the tier level or the cost of a medication from one year to the next, so say you were paying $5 for Novalog this year, next year they're jumping it up to $50 copay, which is a problem for you. You like the plan, but $50 is a little excessive. You can ask for a tier exception of the plan to see if they will keep the copay for you specifically at $5. You can, if they decide to, Novalog goes generic, they decide they're no longer going to cover brand name Novalog, they'll only cover generic Novalog. You can ask for a, again, that would be kind of a formulary exception. Those kinds of exceptions requests usually require the backup of a doctor and are a good reason for needing that exception. But again, that's why I encourage people to take advantage of open enrollment to see if there's not a plan out there that's going to suit you better or save you more money. Exception requests are always an option, but there's
Thank you.
not always a guarantee that that
Thank
will
you.
happen. So yeah, I mean, anytime something like that happens, even during the year, you can always request an exception if something happens with a plan that you disagree with in any way, shape, or form. There's always a process that Medicare has put in place for you to disagree with that plan and try and get that decision reversed or that rule reversed. Medicare always has a process in place for you to disagree with something and try and get that changed.
Thank you.
You're welcome. Thank you. All right. So the other thing I want you to keep in mind is that your SHIP office is there. This is what we do. This is what we're here for. And we're always happy to help people with plan finder searches, especially during open enrollment. Let me share my screen again and we'll wrap this up. All right, so some quick tips if you're going to use the plan finder on your own. Again, making sure you enter your medications as accurately as possible is the most important thing you can do. Quantities, dosages, whether it's ER versus SR versus delay release, the difference between a capsule and a tablet can be huge. That has to be accurate. Don't be afraid to compare multiple pharmacies. As I reviewed with you, there can be a huge difference in what you pay depending on the pharmacy you choose to use. Remember that the plan finder will always list the end result in order of most cost-effective options at the top. As we went down that list, the costs went up. So let the plan finder do the work for you. And then don't worry about playing with the plan finder. If you are creating an account or you're not creating an account, you can go into the plan finder and add drugs, subtract drugs, play with dosages, play with pharmacies, play with quantities. You can change all of that information in any way whatsoever. You can't break anything. You can't accidentally enroll in anything. You can't make a mistake, because unless you hit an enroll button and go through a few pages of actual enrollment forms, you're not gonna make any changes you didn't intend to make. So feel free to go in and play with it. Make those changes, make those edits, see what options might work out best for you, play with the different pharmacies, see what pharmacies might be more cost effective for you. It's okay. You can't break anything. You can't do anything you didn't intend to do. Again, we looked at the plan finder. We were looking at Part D plans only, but there were a couple of ways that you can also look at Advantage plans. We're not going to go over Advantage plans today, but we certainly could do that on a one-on-one appointment. But if you click either on this link up here, Advantage plans, or there was that drop-down box that says you could pick between Part D or Advantage plans, it's going to give you the same information in the same format for the drug coverage through Advantage plans. It will also give you additional information about the costs for medical services with Advantage plans. If you're an Advantage plan and you're looking at open enrollment and thinking you might want to change from one plan to another, just a few tips to keep in mind. You want to make sure whatever Advantage plans you may enroll in or think about enrolling in cover your medications that you take. You want to check with your doctors to make sure that they take any other Advantage plan you may be looking at. You may want to check which hospital network that plan contracts with if you have a preference. If you're going from a PPO to an HMO and you have to see a lot of specialists, you may want to check to see if you're going to have to pay copays or get referrals to see the specialists, those kinds of things. So a lot more factors to take into consideration with Advantage plan changes than just the drug coverage. And that's about it. So I did include in the email that I sent that had the handouts, this PowerPoint presentation. I also included the handout on how to create an account on the Medicare website. I gave you a handout about marketing for Medicare Part D and drug plans, the do's and don'ts of insurance agents and brokers. Keep in mind that your SHIP office is always available to you. We are open Monday through Friday and available by phone from 9 to 4. We were looking at being open to the public, but we have since backed down on that a little bit. Appointments are encouraged. Please call first instead of just coming to the office. Walk-ins are discouraged. We're going to appointments only, but we are always happy to help you. We have 5 counselors and a volunteer available to help you with any questions or concerns you may have. And if you're calling from anywhere outside of the 9 counties our office serves, you can call the toll-free statewide number and it will route you to the SHIP program closest to where you're calling from. And that is all I have for you today. I know we went over time a little bit, but this was a lot of information to cover. Any other last minute questions or concerns before we let you go? Again, you can unmute or type into the chat box. If not, if you think of any questions you have or think of after the presentation is over, again, you can always call us at our numbers listed here, or you're always welcome to shoot us an email with your questions. We're happy to talk to you at any time about any of these, any questions or concerns you may have. We will be starting to schedule appointments for open enrollment at the beginning of October. So you're welcome to call and schedule an appointment, one-on-one appointment with a counselor starting in October. And if I hear no other questions, I'm going to thank you all for joining us today. I hope you found this information helpful. Please let us know if we can help in any other way. And I'm going to say good afternoon and thank you for joining. Take care.